Tetrahydrocannabinol, or THC, is one of the main active compounds in cannabis. It may reduce pain in MS, and it's also being researched in people with nausea, insomnia, and seizures. Tetrahydrocannabinol, THC, is also known as delta-9 tetrahydrocannabinol. It's the primary component of cannabis responsible for its psychoactive properties. THC is considered to be a secondary metabolite of the marijuana plant. Scientists think that it serves as a plant's defense mechanism. It repels animals and insects, and it prevents them from eating the plant. According to some estimates, medicinal use of cannabis dates back as far as the 16th century BC in ancient Egypt. Documents show it also subsequently was used by the Greeks and the Romans. Another line of evidence suggests its use more than 5,000 years ago in what's now Romania. Yet other sources claim that cannabis was used before the Christian era in India. Archaeological and historical findings indicate the plant was cultivated for fibers since 4000 BC in China. A cannabis extract containing THC metabolites was found inside a tomb in Israel on the remains of a young woman who appeared to have died giving birth. The archaeologists who discovered the tomb speculated that cannabis was used to facilitate the birthing process. Sativex is a cannabis extract formulated as a spray, and it contains similar amounts of THC and CBD, 2.7 mg of THC and 2.5 mg of CBD per spray. It's been approved in Canada and the UK as an add-on treatment for the symptomatic relief of neuropathic pain in adults with treatment-resistant multiple sclerosis. Sativex may also be used to relieve pain in advanced cancer patients who don't respond to high doses of opioid painkillers. Sativex is an oromucosal spray and it should be applied under the tongue as directed. CBD, the non-psychoactive compound from cannabis, has become more popular than THC recently. It was legalized in many parts of the world, and it's mainly sold as a supplement. On the other hand, a synthetic form of THC called Dronabol is FDA approved for AIDS-related anorexia and chemotherapy-induced nausea and vomiting. Sativex, the spray containing cannabis extract, has been shown to improve self-reported symptoms of muscle stiffness and spasticity, urination frequency, and neuropathic pain associated with MS in several clinical trials, including thousands of patients in total. Evidence about other cannabis extracts is conflicted. One small clinical trial suggests that oral cannabis extract reduces muscle stiffness and spasms and improves sleep compared to placebo. The daily dose was titrated up to 25 mg of THC and 8 to 18 mg of cannabinol. Larger trials suggest that cannabis extract does not objectively improve spasticity in the MS. In another study of 50 MS patients who took a different CBD-THC combination, 2.5 mg THC and 0.9 mg CBD per capsule, reported somewhat reduced muscle tightness and improved sleep. Lower doses had a weaker association. The authors suggest some MS patients in the study needed higher doses to get relief. Better designed trials on different cannabis extracts are needed to determine the effects of the THC-CBD combinations on MS. Additionally, some epidemiological studies have suggested smoking cannabis may reduce self-reported muscle spasms, pain in the arms and legs, and tremors associated with MS. The effects of smoking cannabis on MS have not been evaluated in clinical trials. An analysis of 5 small clinical studies concluded inhaled cannabis providing 1.6 to 96 mg of THC per day reduces the intensity of neuropathic pain caused by HIV, trauma, diabetes, chemotherapy, and other conditions in up to 2 weeks. In one small clinical trial, inhaled cannabis containing 2.9% or 6.7% THC reduced neuropathic pain due to spinal cord injury. The effect was immediate and it lasted less than 2 hours. Some human studies show mixed results regarding THC's effectiveness for other types of pain, as is the case with sunburn and capsicum-triggered pain and inflammation in healthy volunteers. In HIV, cancer, and other life-threatening diseases, these often lead to decreased appetite and muscle wasting. THC and cannabis extract has been studied for stimulating the appetite and mitigating the cachexia in these patients. However, there's not enough data to rate its effectiveness. In one study, a standardized cannabis extract, 2.5 milligrams of THC, 1 milligram of CBD, twice a day, didn't seem to increase the appetite compared to placebo in patients with cancer-related anorexia cachexia. This study had several major limitations. However, the placebo response was exceptionally high, as was the dropout rate. Better designed trials are needed to determine the effects of cannabis extract and CBD on decreased appetite, nausea, and muscle wasting in people with life-threatening diseases. In another small study on HIV patients, inhaling THC reduced the levels of peptide PYY, an appetite suppressant, while increasing levels of leptin and ghrelin. So-called delayed nausea and vomiting, induced after completing chemotherapy, is an issue for many cancer patients. In a small clinical study, a spray containing standardized cannabis extract prevented delayed chemotherapy-related nausea and vomiting. It helped 71% of the patients, compared with 22% of the patients who responded in the placebo group. The spray was used 3 to 5 times daily for up to 5 days after completing a chemotherapy cycle. Larger clinical trials should confirm these findings. Despite anecdotal claims, it's still unknown whether cannabis and THC improves glaucoma. Smoking cannabis or Sativex spray seem to reduce eye pressure in people with glaucoma, but the effect may last for only 3 to 4 hours. Another older study suggests smoking cannabis reduces both eye pressure and blood supply to the eye. Reduced eye blood flow has been linked with vision loss in some types of glaucoma. Better designed studies are needed to clarify these findings. It's not yet known how THC and cannabis affect insulin sensitivity and weight. An epidemiological study found current marijuana use is associated with 16% lower fasting insulin levels in comparison to past marijuana use, and 26% in comparison to people who never used marijuana. This trend was also similar for other insulin-resistant metrics. However, clinical trials are needed to determine whether the THC increases the insulin sensitivity. On the other hand, limited studies suggest rimabant, a mild cannabinoid receptor 1 blocker, increased insulin sensitivity in adipositin-dependent manner. Rimabant is an anti-obesity drug, and it's mainly used to act to reduce the appetite, and this can explain the effects. This drug is not approved in the US due to the risk of psychiatric side effects like depression and suicidal thoughts. Many studies suggest marijuana has profound effects on sleep, which may be detrimental in the long run. However, most of the data comes from epidemiological studies and surveys. We're in need of proper clinical trials. According to one study, THC and smoked marijuana seem to decrease the time that it takes to fall asleep, and to increase stage 4 sleep, or deep sleep, but they decrease REM sleep, which is a phase associated with dreaming. People who stop using cannabis often report difficulty sleeping and strange dreams for a short period of time. CBD may be more beneficial for sleep purposes, as THC can cause a racing mind, whereas CBD can calm and relax the mind. Based on studies in mice, scientists think THC might reduce pain by potentiating the glycine receptor. In mice, THC activates CB1 receptors and increases the release of agmatine. Agmatine seems to increase pain tolerance and overall body temperature. Chronic THC exposure in mice resulted in increased brain-derived neurotrophic factor in the hippocampus, but not in the frontal lobe. THC appears to reduce seizures in rats, but CBD has been more thoroughly researched for the effect in people with epilepsy. Marijuana smoking seems to increase cerebral blood flow for up to 2 hours afterwards. Scientists are investigating whether THC can reduce amyloid plaque levels and inflammation, and improve mitochondrial function in cells. Some researchers think THC causes a euphoric state by increasing dopamine, although the chronic use of THC may blunt dopamine receptors. The effect of THC on the dopamine system appears to be dependent on dose and duration of use, but human studies would be needed to determine this. On the other hand, recreational marijuana use has been associated with other unhealthy behaviors, such as high-calorie diet, smoking, and other drug use. However, studies drawing these associations were limited. Simply put, not all people who use marijuana recreationally lead unhealthy lives. Additionally, have in mind that this study dealt only with recreational and not medicinal marijuana use. On the other hand, mechanistic studies are investigating the effects of THC on reducing cardiovascular disease risk. No human studies have been carried out so far, so it's still unknown how THC and cannabis affect heart health. Studies show patients with atherosclerosis, or hardening of the arteries, have increased levels of foam cells in the major arteries, and this leads to the buildup of cholesterol and fatty plaque. Scientists believe the CB2 receptor is present on the surface of the foam cells, and that THC may activate them, which would theoretically prevent them from depositing fatty streaks in the heart. However, this hypothesis has not yet been verified. Pathways that THC act upon inhibit 15-lipoxygenase, an enzyme that oxidizes low-density lipoprotein, reducing platelet accumulation and promoting immune function, which might block atherosclerosis. Some rat studies suggest small amounts of THC might reduce atherosclerosis in lab animals without psychoactive effects. In one small experimental study, direct injection of THC into the glioblastoma tumors in 2 patients was safe. It was also hypothesized to have some effect on tumor cells. Glioblastoma multiforme is a form of brain cancer with limited treatment options and a low life expectancy. Future clinical trials need to determine the effectiveness and the safety of THC brain injections in people with this type of cancer. Scientists are investigating the effects of THC on certain types of cancer and pathways in cells and animals, such as in combination with CBD on brain cancer cells, on the ERBB2, AKT, and mTOR pathway on breast cancer cells and mice, on the EGF pathway in lung cancer cells and mice, and on prostate cancer cells. In a survey of people who are habitual THC users, but not cigarette smokers, the use of THC did not increase the incidence of lung cancer, although negative outcomes from smoking THC were not ruled out. The most common adverse effects caused by smoking cannabis or using Sativex oromucosal spray are headache, dizziness, drowsiness, fatigue, dry mouth, nausea, paranoid thinking, and disassociation. THC has been reported to cause schizophrenia-like symptoms, altered perception and increased anxiety, delayed recall time, impaired mental performance, and increased cortisol or stress hormone in some people. This is more associated with THC that's consumed without CBD to balance its effects, or in high doses for long periods of time. After ingesting a high dose of THC, increased levels of adrenaline were detected after 2 hours, but then returned to normal after 4 hours in one study. Cannabinoid is hypothesized to impair working memory through the CB1 receptor in the astroglial cells. One study linked the chronic consumption of cannabis with increasing the odds of getting bipolar disorder and manic episodes. These findings have not been properly verified, as bipolar patients may be more prone to seek out THC to self-medicate. THC may reversibly block synaptic neuroplasticity in the nucleus accumbens and the hippocampus. Chronic THC use in humans is hypothesized to reduce overall dopamine synthesis. This may theoretically reduce motivation. Low-dose paternal THC exposure seems to enhance the dopaminergic activity in offspring via epigenetic modulation of the cannabinoid receptor in the sperm cells, whereas high doses seem to reduce dopamine activity in the offspring. According to one study, high-potency cannabis may impair creativity and divergent thinking. Repeated use of cannabis might result in intolerance due to a reduction in the CB1 receptor. Prior THC exposure makes nicotine more addictive in rats. Cannabis extracts may be safe when used for up to 2 years in the form of Sativex, a spray that should be applied in the mouth. This product is available as a prescription drug in the UK and Canada. It's an investigational new drug in the US that's not approved by the FDA. Inhaling cannabis is likely unsafe. Smoking cannabis can cause respiratory problems such as coughing, wheezing, and inflammation. Cannabis use has been associated with health complications, addiction, cognitive and mood issues, and withdrawal syndrome. Cannabis use during pregnancy is unsafe. Cannabis passes through the placenta and it can reduce fetal growth. It's also been linked with other abnormalities and health complications in newborns. Breastfeeding women should not use cannabis. THC passes in the breast milk and it's been linked with delayed motor development. THC and cannabis extract can interact with many drugs. Interactions with the following group of drugs are possible: hypnotics and sedatives, opioid painkillers, anesthesia drugs, anti-seizure drugs, blood thinners, certain antibiotics and antifungal drugs, statins, certain antidepressants, and alcohol beverages should also be avoided. Clearance of THC involves the CYP 450 in the Phase 2 liver detoxification. Many different routes of THC administration have been described in the scientific literature, with varying absorption and elimination rates. Smoking or absorption of THC via the lungs seems to result in absorption rates between 2 and 56% bioavailability of the THC and its metabolites. Peak levels in the blood are detected after 12 minutes. Smoking cannabis can cause other side effects from smoke exposure. Oral ingestion of THC results in a lower, more gradual and blunted peak in serum concentration of the THC. Serum levels peak about 1.5 to 2 hours afterwards. Chocolate cookies with cannabis have a 6% bioavailability, 1.5 hours post-ingestion. Absorbed cannabis is also subject to first-pass liver metabolism. Sublingual, rectal, and skin uses of THC bypass the digestive system and the first-pass liver metabolism. In addition, the THC metabolites may stay longer in the system. THC is a high fat-soluble substance. This means it can stay longer in the lipid-rich tissues such as the lungs, heart, brain, and the liver. Studies suggest brain levels of THC are almost always higher than blood levels, and there may also be THC in the brain even when it's absent from the blood. Chronic use of THC may result in THC accumulation in the fat tissues.